Hi, and welcome to this month's video series. This month we are talking about functionally equivalent interventions or function-based interventions. And so just to go over a recap of everything that we've talked about prior to this that's important to remember is the first thing you want to do when you're thinking about behavior intervention is identify the function of the behavior. I cannot stress how important this is because you want to make sure that your behavior intervention, especially your consequent-based interventions, are functionally equivalent. So remember, your four functions of behavior are attention, escape, tangible items or activities, or sensory. Automatic functions. And so you want to be thinking about not the behavior in terms of the topography or the form of the behavior, but you want to be thinking about behavior in function. So if you haven't already watched our videos or the series on functions of behavior, please take a moment, go back and watch some of those videos or watch that entire series on functions of behavior because it's so important to identify the function of behavior before you decide on the behavior intervention that you're going to implement. The next thing that you want to do is talk about your replacement behavior. So what is it that I want the child to do instead? So if the child is screaming, what is it that I want them to do instead? Do I want them to functionally request an item? Do I want them to ask to sit down and talk? Do I want them to ask for a hug? What is it that I want them to do instead? So what is my replacement behavior? If they're frequently out of seat, what is it that I want them to do instead? Do I want them to stay in their seat? Do I want them to raise their hand and ask before they get out of their seat? What is that replacement behavior? What is it that I want the child to do instead of what they're doing now? Because you have to always look at, if we take away a behavior, we have to replace it with something else. So you can't take away a behavior without giving a new skill or a new behavior, a new way to access that function, okay? And so then once you have your replacement behavior, then you want to think about, can the student or can my child already do this behavior? So is it something that they can already do, or do I need to teach it? So that's when you do that can't do, won't do. Okay, so if you haven't watched last month's series on skill deficits or skill-based intervention, go back and look at that because that really talks about how do I know if the child can do this skill? Because a lot of times we overlook skill deficits. Following multiple step instructions. So go get your shoes, your backpack, and get in the car. That's 3 steps. A child with ADHD likely cannot complete 3-step instructions. So get out your pencil, turn to page 52 and start on number 1. That also is 3 steps. And so it seems very simple to us as adults with average intellectual functioning and with average processing speed. But to a child that may have deficits in their frontal lobe functioning or intellectual functioning or behavior executive functioning, then they may not be able to hold in their mind even those 3 simple steps. So it could be an underlying skill deficit that we need to address in addition to our reinforcement or our motivational performance-based strategies. And the last thing that you want to do is to add motivation to use the replacement behavior to build that skill and to engage in the appropriate behavior. And so you've got to add in that reinforcement or motivation because we may have the skill. I have the skill to run. I can run. I can be a decent runner, but I choose not to run because the motivation isn't there. And so sometimes you have a child who can engage in a behavior that you want them to do, but they choose not to because we don't have those motivating factors in place, that reinforcement in place. And so it's easier to engage in the challenging behavior of tantrum or screaming or verbal refusal, negotiation. It's easier to do those things than it is to do the hard thing of engaging in that replacement behavior. So once we have that replacement behavior in place, not only do we need to make sure and teach the behavior, but we have to reward the behavior for occurring. And the last thing, I think I said the last thing already, but the very last thing that you want to do is you want to stop rewarding the inappropriate or the challenging behavior. And so we'll talk about that a little bit this month. That may involve some punishment strategies, or it may involve some other strategies. And so we're just going to touch on punishment this month. That's an entirely different series that we'll address at a later point in time. But you have to stop rewarding or stop honoring, stop following through with the consequences of that challenging behavior. So if the child is getting attention, which is what they want for the negative behavior, we have to stop providing attention for that negative behavior. So that's a consequent-based strategy. So that's what we're talking about this week, or this month in this series. So if you haven't already, make sure that you watch the function-based intervention series. Make sure you watch the skill-based intervention series, because those are two definite prerequisites to this next series. Thank you, and I look forward to bringing you more information.